My name is Lauren Tiffin.
My name is Rachel Michelle.
We co-founded the AIDS Awareness Society in 2015 to give a voice and spread awareness to the HIV/AIDS disease in the NYU dental community.
Our goal for this video was to raise awareness and education and let our voices be heard to the masses in honor of World AIDS Day, which is December 1st.
There are approximately 36.7 million people worldwide living with HIV/AIDS.
1.8 million children worldwide are living with HIV.
More than 1.2 million people in the United States are living with HIV.
All viruses, including HIV, are small little entities, little particles that get into your cells. And basically what they do is they tell the cell make more viruses.
HIV lowers your immune system and you die from something else.
When I was training and doing my residency program, there was a lot of mystery around HIV/AIDS, and people were really scared, fear of the unknown.
Back then, of course, it was a death sentence.
Since 2000, around 25.3 million people have died of AIDS-related illnesses.
About 1 in 4 new HIV infections is among youth ages 13 to 24.
35% of young people have an awareness about HIV.
1 in 8 people with HIV are unaware of their infection.
The oral cavity may be the first body part to show signs of an HIV infection.
Oral health care providers are at the forefront of medical care.
Approximately 20 million people in the United States every year only see a dentist as the only health care professional they've seen.
So I think it's important for dental care providers to be aware of these manifestations and what to look for.
So in my career, I have diagnosed, I think, 8 patients who didn't know they were HIV infected.
There are currently 35 FDA-approved drugs used in the treatment of HIV.
Over the last decade, the annual number of new HIV diagnoses has decreased by 19%.
In 2015, there was $2.1 billion invested in HIV/AIDS response.
The average cost of antiretroviral medications dropped from $10,000 in 2001 to $100 in 2014.
We're educating the future generation here, a significant proportion of future dentists.
The curriculum here at NYU is rich in in the didactic material necessary to train dentists how to manage patients with HIV disease.
So an oral health care provider should be an advocate for all aspects of health.
Frankly, I think it would be very rewarding to know that you may have saved somebody's life.
The life expectancy of someone living with HIV was 36 years in 2001, 55 years in 2014, and it is projected that in 2030, the life expectancy will be the same as someone living without HIV.
NYU Dentistry.
NYU Dentistry.
NYU Dentistry.
Acts against AIDS.